Amit Yadav is my name. I'm the CEO for GE Healthcare in Australia and New Zealand. I lead a team of 450 odd talented professionals that are really here to serve in the healthcare space, particularly in diagnostic imaging, in monitoring, and in our ultrasound business. Really aiming at serving healthcare professionals to really reach our objective, which is to create a world where healthcare has no limits, and doing that through precision healthcare, using devices that are connected and smart from an AI perspective to help improve patient outcomes. My journey in healthcare has been really as a clinical radiographer. I started. St Vincent's Public Institution is where I did my internship, if you will. Spent some time in some private clinics thereafter, and then joined GE as a CT trainer, what we call an application specialist. So in the field, helping customers learn their new device and how to maximize operational efficiencies from it. And then throughout that journey after that, it's been really commercial roles in account management, product roles locally, and a short stint into AKA, or Asia Pacific as we call it, and then back to Australia. I'd say our technology building blocks that we're forming and foundationally growing from is 125 years of GE legacy, 125 years of healthcare, and 125 years of first-time innovations in healthcare. With that, we've got a number of assets in the marketplace already, with clinicians being used by customers and alike. But really what we're now building on is the AI infrastructure that's been so prevalent in the market in terms of how it's been discussed and implemented in through devices. So some of the building blocks that we're talking about are AI in medical imaging devices, for example, radiology, workflow efficiencies, and how do you leverage the data and data analytics that are sitting in healthcare systems, and how do we then connect those devices through a hospital infrastructure? Because at times those infrastructure departments are siloed out, making it complex and costly to extract data from. The hospital and healthcare in general really produces 30% of the world's data source, and of that, really 97% of it is unused. Untapping those data lakes, if you will, within an institution is going to be pivotal. When we talk about productivity, it's really around how do you help devices automate processes that are otherwise manual, stop the duplication of data because you've got data sitting in silos between departments and also public and private institutions. How do you really bring those together and leverage the data that's within them? How do you then think about workflow optimization? So that could be scheduling, it could be automation of positioning devices in radiology, for example. When you think about monitoring, what we're working towards is how do you send the right alarm signal and decision-making capabilities to a clinician or a nurse that's in front of a patient, right, in a ward? How do you send the right message in terms of the alarm without fatigue? So we're conscious of that there's a lot of data and a lot of information, a lot of signals coming to an individual. How do you send the workflow that may come in from ED to triage to an ICU to the end patient? So how do you create these virtual scenarios so that patients and people understand what a flow should look like and optimize that from the start? In terms of the safety aspect of it, from a GE perspective, we are really focused around making sure that we meet local regulations and standards that are in place by the TGA or other bodies, whether that be colleges or alike, but also leveraging our global footprint to make sure that we bring best practice to Australia and Australian patients. I think in terms of, how we go about that education for customers is also a crucial element, right? So I would say that we're working in partnership with the colleges to help educate, to help, the new or next generation of leadership in healthcare really understand what AI can do, what digital can do, but also its limitations, because I think there are some that need to be understood before we deploy too far. I'd say clinicians are getting a lot better at understanding AI, its digital implications in terms of patient treatment and being personalised towards the outcome that they need to generate. We're also doing some collaboration work with partners like Amazon Web Services, AWS, in terms of how do you deploy enterprise-wide solutions at scale that are easy and simple to use for clinicians, whilst they're understanding the AI piece a lot better. And colleges are definitely investing in training and education programs within their continuing professional development, and the universities are already talking to us about how do we do this at an undergraduate and postgraduate course level. That'll continue, But I think the partnership with people like AWS, where you can bring simplistic tools that really drive the outcome through tools that are really customized in the sense that they're really using foundational models that are purpose-built and generative AI that's tailored to what a clinician really wants to be able to understand and see at the time that they need it. Those tools will be simpler, but I think, again, we go back to they also need to understand the limitations, and the data sets are really important. In data sets, we talk about two elements really. One being the quality of the data that's in it, in terms of, does it have inherent biases within the data sets? And is it representation of the population that you wish to serve? Because either of those misalignments could mean an outcome that's not what the clinician's looking for. What I would say is that Australian clinicians are very much in tune to leveraging AI. They're wanting to adopt it, but they're also wanting to make sure that we do the right thing from a patient safety and an efficacy perspective. We have a workforce challenge in terms of shortage of people, staff, and talent, particularly if we think about regional and rural areas and getting people to those areas. AI and digital technologies and those understandings and how do we support communities in those areas is something that clinicians are really well versed in, and trying to think about how to solve tough problems that we've got in Australia using digital tools. I think our adoption rate is really good. In terms of our knowledge base, it's growing, and it's going to continue to grow as we all do in terms of what tools are available and how do we deploy them well.